What is deep vein thrombosis and what are the treatment options?
Deep vein thrombosis is a relatively emergency condition in which the bad blood vessels, we call them as veins in the limb, will get occluded with clotting of the blood. So this results in complete stoppage of the blood flow towards the heart. So this is relatively fatal and this is relatively emergency and a fatal condition. If you don't treat properly, it can cause sometimes life risk also in terms of by causing pulmonary embolism and all. So apart from that, and coming to treatment options, like we can manage either way, like conservative or with active intervention.
What are the common symptoms of deep vein thrombosis and how is it diagnosed?
Deep vein thrombosis is manifested by sudden swelling and severe pain of the of your leg or limb, and it results in significant swelling, and there is tightness, heaviness of the limb, and sometimes there will be some redness also. So in very severe and fatal conditions, maybe due to already happened pulmonary embolism, you may experience cough and breathlessness also. And the first modality we used to diagnose the deep vein thrombosis after initial clinical examination is ultrasound Doppler. With a simple ultrasound Doppler, we can diagnose the deep vein thrombosis. So where you can see complete clot-filled blood vessels and Doppler with no color flow uptake.
Who are the eligible patients for a radiological intervention?
Patients fail to anticoagulation part, there is ongoing and active pulmonary embolism part, and there is active stenosis of the draining vein or extensive compression due to May-Turner syndrome or any other external factors. These patients should definitely have to undergo intervention.
What is your clinical experience on the results and the present literature evidence for this procedure?
I started on my own from the last 2 years. I have seen so many patients of DVT where in some patients I kept them on routine anticoagulations, and some patients I actively intervene to get the best results. So as far as I concerned, I did till 30 cases with active intervention part. In those, mainly the involvement of central veins like IVC, common iliac veins, and external iliac veins is one criteria, and already happened pulmonary embolism. Initial, there is no much response with, as I said before, like anticoagulants. 90% of the clot we can able to prevent embolism or put a filter, and then we do pharmacomechanical thrombectomy with antithrombolytics and some mechanical devices to clear the clot part. So happily, almost all the patients got significant symptoms resolution, and they went happily to the home within next 2 to 3 days.
What is your message to the general physicians about managing the patients in their OPD settings presenting post-procedure?
Treating DVT is really important. Apart from routine pulmonary embolism and routine symptoms control, if you don't treat properly, DVT can cause much trouble to the patient in later life in terms of causing post-thrombotic syndrome. Because once patient lands in post-thrombotic syndrome, we cannot do much to the patient. So she or he will keep on complaining of leg swelling, repeated ulcers, leg pigment, significant pigmentation, and it will be very cumbersome to the patient. So my message is very clear. So always rule out the underlying factor, like whether we have to treat in conservative manner or active intervention, but